Mesothelioma is an aggressive form of cancer that develops in the lining of the lungs, abdomen, or heart. Given its rarity and difficulty to treat, clinical trials play an important role in advancing treatment options for patients. Several active mesothelioma trials are currently recruiting patients at major cancer centers across the country. I would be happy to provide recommendations of specific trials in your local area that may be options worth exploring further. One of the top centers for mesothelioma research in the United States is the University of Texas MD Anderson Cancer Center in Houston, Texas. MD Anderson has several immunotherapy and chemotherapy clinical trials actively recruiting for mesothelioma. One such trial is assessing the combination of nivolumab, Opdivo, and ipilimumab, Yervoy, for unresectable pleural mesothelioma, NCT02879371. This is an important study as immune checkpoint inhibitors like nivolumab and ipilimumab have shown promise for other tumor types, but more data is still needed for mesothelioma. Another promising trial at MD Anderson is evaluating the addition of pembrolizumab, Keytruda, to standard chemotherapy for advanced mesothelioma, NCT03063450. Pembrolizumab is an anti-PD-1 drug that may help activate the immune system to better fight the cancer. Both of these immunotherapy trials allow for participation regardless of PD-L1 status, expanding options for more patients. For patients who cannot travel to Houston, Maryland, Anderson has affiliations with many major cancer centers nationwide where local enrollment may be possible. Staying in Texas, another leader in mesothelioma research within driving distance is the University of Texas Southwestern Medical Center in Dallas. They currently have an open phase 2 trial combining sovolitinib, an oral MET inhibitor, with pemetrexed, cisplatin as first-line therapy for unresectable pleural mesothelioma, NCT03143663. Dysregulation of the MET pathway is common in mesothelioma, and early studies found sovolitinib may enhance response rates when combined with chemotherapy. The medical center is also recruiting for a novel trial combining photodynamic therapy with chemotherapy and bevacizumab for resectable pleural mesothelioma, NCT02925164. This investigational approach uses light-activated chemicals and anti-VEGF therapy to potentially improve outcomes after tumor debulking surgery. For patients in North Texas, enrollment in these local trials may be more convenient than traveling out of state. Moving to the West Coast, the University of California, Los Angeles has multiple phase 2 mesothelioma trials in progress. Their thoracic oncology program is assessing the addition of maintenance pembrolizumab to induction chemotherapy with cisplatin, pemetrexed, NCT03155620. Continuing PD-1 blockade after initial chemo may help sustain anti-tumor responses over time. They are also exploring a VEGF trap fusion protein called aflibercept, combined with cisplatin, pemetrexed as first-line therapy for advanced mesothelioma, NCT02158858. Blocking the VEGF pathway along with chemotherapy represents a novel dual pathway blockade approach. For residents in Southern California, participating in a clinical trial at a renowned cancer center like UCLA could provide access to cutting-edge therapies without long-distance travel. Shifting to the East Coast, Memorial Sloan Kettering Cancer Center in New York is at the forefront of mesothelioma research. They have multiple immunotherapies and targeted agents in clinical testing. One trial is evaluating the combination of the anti-PD-L1 drug durvalumab with tremelimumab, a CTLA-4 inhibitor, in previously treated pleural mesothelioma, NCT02588131. Simultaneous blockade of these two immune checkpoints could induce more robust and durable responses versus single-agent PD-L1/PD-1 inhibitors. A separate trial is assessing the MET/VEGFR2 inhibitor cabazantinib with nivolumab for relapsed mesothelioma, NCT03052608. Dual inhibition of these pathways may provide clinical benefit not seen with cabazantinib alone. Patients living in the New York, New Jersey area have convenient access to potentially life-extending options through participation in these immunotherapy and targeted therapy trials at Sloan Kettering. For residents in the Midwest, two notable cancer centers actively recruiting for mesothelioma clinical trials include the University of Chicago and the University of Iowa. At the University of Chicago, an ongoing phase half study is evaluating the combination of gemcitabine with the MEK inhibitor MEK162 in platinum-resistant mesothelioma and other tumor types, NCT0335E716. Dysregulation of the MAP pathway downstream of RAS/RAF mutations contributes to chemo resistance. MEK162 represents a targeted strategy to potentially restore sensitivity. The University of Iowa has two open trials, one exploring pembrolizumab monotherapy in previously treated pleural disease, NCT03015129, and another assessing the multikinase inhibitor cabazantinib in combination with nivolumab in relapsed cases, NCT03052608. Patients residing in Illinois, Iowa, or surrounding states could participate locally without extensive travel. Several active clinical trials for mesothelioma are currently recruiting at major cancer centers across the United States based on region: MD Anderson Utah Southwestern, and UCLA in the Southwest, Sloan Kettering and Memorial Cancer Institute in the Northeast, University of Chicago and University of Iowa in the Midwest. While considering standard therapy options, clinical trials represent an avenue for potentially life-extending treatments and make a valuable contribution to the scientific understanding and future management of this cancer. I'd be happy to provide more details on any of these options or discuss others that may be accessible within a reasonable distance based on your location. The decision strongly depends on individual circumstances and comfort level with investigational therapies versus proven standards of care.